All righty. Welcome everybody to the third and final live stream of the 13th Annual Medical Aesthetics Bazaar going on now. We're halfway through the week. We have today, Thursday, and Friday left to take advantage of our awesome MAB specials. Right now we're going to talk about Sculptra. We have Rachel and Melanie here, and they're going to talk about it. But first, I wanted to talk about our giveaway for this final stream of the week. It's going to be a treatment with 1 vial of Sculptra. So it's a great way to try this amazing collagen boosting treatment and to learn more about how it works. They are going to talk about that. But if you do want to be entered into this drawing, again, as the previous several sessions, go ahead and put your names in the comments, whether you're on Facebook, YouTube. If you're watching our behind the scenes camera on Instagram, go ahead and put your name in the comments and we will put you on our wheel of names and hopefully you will win when we get to the end of this presentation and draw the winners. So any questions you have, please also let us know in the comments and we will certainly address those too. All right, well, I'm gonna hand it over to Rachel and Melanie. Here we go.
Hello, everyone. So I know first we want to give you the pricing. I don't see it on my screen, and I know it, most of it by heart, but I don't want to misquote you. There we go. Okay, so it's also going to come up again at the end of the presentation. So it might be difficult right now for somebody new to considering Sculptra to know how much to purchase. I'm hoping that we can get to that point and address that for you. And if you're coming to the event tomorrow, please take the opportunity to visit our Sculptra rep. She's fabulous and she can really help determine based on you as well. But hopefully we'll answer it for you. And then we'll revisit this slide again at the end of the presentation. Oh, I know why I couldn't see the screen. It's my job to move it. There we go. Okay. So anyways, besides the technical difficulties, moving on. The reason why Sculptra is so important is it's about replacing lost collagen. And I know we've talked a lot about collagen in a lot of our presentations, and we talk about it daily. It's a buzzword. Everybody knows the word. You may not know what it means, but what you do need to know about it is that we lose 1% of our collagen every year, beginning around age 30. So at age 30, you're not producing anything more. It's just a downhill slide from there. And so it's important to consider things that can increase it. And
yeah, so by age 45, we face up to 25% collagen loss. So a quarter of your collagen gone.
Yeah, yep, and 45 is young to think about our lifespan and the things that we're doing. It really is. I mean, at 45, you've got young kids, you're doing a lot in your life, but you have lost a quarter of your collagen. It's important to maybe previous to 45, work on preventing it getting to that point. After the age of 45, restoring more of it. But at 45, we definitely are trying to restore quite a bit of it. Sculptra addresses collagen loss differently than any other modality on the market. It works with your body to help stimulate natural collagen growth. It's natural collagen growth to replace that lost collagen. And it restores volume and fullness and refines wrinkles and folds in the skin. So it's really working to address the underlying cause of aging skin, which is that lost collagen. The way that it works differently from other injectable treatments like hyaluronic acid fillers is it's a biocompatible, biodegradable synthetic material called poly-L-lactic acid. Fillers are a gel, like literally a gel, a hyaluronic acid gel that we inject in the skin, gives us immediate improvement of volume correction. Fillers are fabulous and work great in the skin, but Sculptra works in different areas. So there's some overlap where Sculptra is not going to go and we need fillers, and the opposite is true where we need Sculptra in a lot of places that fillers won't go. So it's that natural regenerative process of the collagen that we want. It's really a slow and controlled inflammatory response that's creating that.
So, do we want to talk about makeup right now?
I would, yeah.
Okay, so think of your makeup routine. You have to get the foundation right before applying highlights or color for contouring or eye makeup. Without the right foundation, it's hard to get the rest of your makeup to look good. Sculptra is like the foundation to provide harmony.
And we have a little video next, which I know on Instagram you won't hear the sound and volume, so I'll try to do my best. Dr. Litos in the video is explaining well what's happening with the aging process and how Sculptra is improving that.
Litos explains how age affects the face. There are 3 important materials that give your face volume and support: bone structure, fat, and collagen. Think of it like your sofa. Bones are like the frame, fat is like cushion, and skin is like upholstery. As your body ages, all 3 of these materials experience changes. First, your bones lose volume. With less bone mass, the cheeks begin to take on a sunken look. When it comes to fat, the cushion, fat is lost or shifts as the face ages, causing the skin to sag. Lastly, age brings a decrease in collagen, kind of like the upholstery. Collagen is the protein in your body that forms the support for the skin. Collagen loss results in weaker skin structure, causing lines and wrinkles to appear. Sculptra Aesthetic can create a more youthful look by helping to stimulate collagen production, leading to collagen loss correction where injected.
Overlaying on bone and muscle, we have new collagen with what the Sculptra has done in that stimulatory process. I know our video's I spoke faster than the video, sorry.
It's a good video to explain how Sculptra works.
Yeah, it is. So we wanted to show some results, sorry, I'll go back. We wanted to show some results of some patients that we've had in the office. And some of our results, I like that they show different ages of patients, so you can see different expectations. This patient is 46 years old. She has done skincare, but you can really appreciate that her skin is absolutely glowing, looks healthy. She is revolumized in the cheek, which has helped to give a more defined jawline. But one of the things about having new collagen under the skin is you get this glow and freshness to it. So we like to call it the Sculptra glow. In fact, it takes a while to see the results of Sculptra. So you'll see some results within a few months, 6 months to a year to see the full results. It's a slow process, but one of the first things you'll notice is that your skin is glowing and looking healthy. So that's the Sculptra glow that we get really excited about.
Yeah, those are fabulous results.
Yes, and while I'll also point out it's taken a long time. I'm not a very patient person either, so 6 months to a year, I agree and understand, is a long time to wait. But when you've gotten there, when we've gotten to that upper plateau where we enjoy where we're at with our results, it's easy to maintain that. We're going to suggest that you do more vials initially, but once we get to that upper plateau, maintenance is easy. It's 1 to 2 vials per year. That's going to look different for different people. So where you're doing more upfront, maintenance is a lot simpler and a lot more affordable. This is a patient who is 11 years older than the last one, and the angle of the photo is different. You can tell by looking at the nose and the chin that it's a little bit different. But if you can see where we've added volume to areas that she specifically lost it, she looks really incredibly refreshed and beautiful.
I think she looks 10 years younger.
Yeah, and I don't know what she's doing for her skincare routine, so we really can attribute that to that Sculptra glow, that the skin looks so much improved. Yeah. So in these 2 cases where we have a 46-year-old and a 57-year-old, when we look at how many vials we're recommending, the general recommendation is a vial per decade of life. That's not always going to be true. Somebody who is more mature with a fuller face maybe consider less than the decade amount, versus also somebody who's younger and has a much more hollow and sallow face might require more than the recommended amount. Both of these patients have been right at the recommended amounts. This is, 5 vials, so maybe a little under if you consider where she's at on the closer to 60 side. The last patient I'll go back to, we used 4 vials to achieve that result. I'm 35. I've had 4 vials. My first treatment with 2 vials was several years ago, and then last week I had my second treatment with Sculptra because I don't often get an opportunity that somebody can inject me, so that was really fun. Still have a tiny bit of bruising from it, but that's one thing I guess we should also note is it is an injectable treatment, and so anytime we do an injectable, the risk of that is going to be swelling and bruising, so you want to just kind of plan accordingly. But we can also treat other areas of the body. So the neck is a good area that we definitely want to consider rejuvenating our collagen. I talk until I'm blue in the face about using multiple modalities to address the neck, and Sculptra is one of those that I think has been a game changer for our patients, and they really have loved what they've seen. certainly, you know, we could do some other things for this patient, but I think this is a really great result. And it doesn't, you can't in a 2D photo get what we see in 4D in real life too. So she has better elasticity of the skin, less crepiness when you pinch the skin together. It looks really nice.
But there isn't anyone that doesn't need some neck help.
Yeah, I agree with
Rachel. And this is just an option for the neck.
Yeah, absolutely. I don't have photos of the glutes, but Sculptra can be used in the glutes to help build volume. It's really a great treatment as an alternative to a Brazilian butt lift, which most people know is a BBL procedure. It's, you know, fairly risky, and so Sculptra is a very safe alternative to doing that procedure. Works very well. Again, it takes some time to see the results, but then you hold on to those results for a very long time. It takes more vials when we're trying to grow that much volume, so it is a larger package, which you'll see in our pricing in a moment, but works beautifully. And then this is a treatment done in their study, so this is provided by the company. So while it's not one of my patients, I felt it was appropriate to include because it really shows how somebody who's very hollow and thin through their lower face but has nice cheek structure can still benefit from Sculptra. A lot of people still are a little bit of the mindset that filler just goes here in the nasolabial fold and in the cheeks, and they don't consider their temples as an option or their lower face as an option, and that's where Sculptra really comes in and shines.
And you can't really tell what she's had done, but she looks better.
Yeah, absolutely, and those results will last for a very long time. And she
is softer and it's nice looking.
I guess what we really wanted to point out here too, and we made a note to not forget about this, is that Sculptra is really about softening contours. We're not trying to give a puffy round face. Some of us have rounder faces like myself anyways, and that exists. But we're really, I know that that's a mindset that we're trying to bring people back from, of just thinking, oh, filler and Sculptra is just like puffy round faces and I don't want that. That's not what we're trying to achieve with either of those treatments. And with the Sculptra, I think you can really see how we can treat what I would say pan facial, so we can treat almost the whole face with Sculptra to soften those contours.
Yeah, I agree.
And then our last before and after picture is just to say that this is a really great treatment to do for a man. Men don't make up a huge portion of our practice. They don't make up a huge portion of most aesthetic practices, but it doesn't mean that they don't see signs of aging that they want to address. They're most fearful more than women about it being recognized that they've done anything. And Sculptra is a great treatment that it's gradual in its onset. It's not an overnight result. In this case, that's exactly what we would want, because no one's going to necessarily notice something that's happened so gradually. You could literally blame this on better quality of sleep, better diet, exercise. I just got back from vacation and no one would know the difference or be the wiser.
No one would ever know what he had done, but he looks fabulous with a little bit of Sculptra.
Yeah, and again, holding on to those results for so long is so important to me, because I am invested into your long-term outcomes. That's where I derive the most joy from my job, is when we can look back and see what we've done over time and over the years and how well that's, lasted us and how much better and improved we continue to look.
So I just want to say really quick before you move on, I want to say that there are not very many, I've worked with a lot of injectors and not all of them are good at Sculptra, and Melanie is fabulous at Sculptra. So if you are thinking, you are.
Well, if my rosacea wasn't under control, you'd see me blushing right now. Thank you for that, Rachel.
Well, she is. She just did another training. She does a training literally every year at least. I mean, she's always doing trainings on it. She is the best Sculptra injector I've ever worked with.
Well, thank you for that. I just truly enjoy what I do, so it's fun for me to invest my time and money into my education and trainings. So it's easy.
She actually cares.
I do, but I like it too, so it's fun. It's easy to do something when it's fun. Okay, I'm going to revisit the slide about pricing so that we can kind of now explain a little bit more what this means. So Sculptra is regularly priced $900 per vial. Somebody who's only looking to purchase one vial is probably only going to be somebody who's doing routine maintenance. Those are my patients that have already been doing Sculptra. They know they love it. If you're super happy with where you're at, just buy your vial. We'll sprinkle it throughout the face for that collagen growth and development. It will be great. If you're 30 or above, you really should be buying at least 2 vials. If you want to follow that decade per life, then do the packages of the 4 or the 6. If you're feeling like you're not quite sure where you land, 2 is a great place to start. If you know that you're thinner and more hollow in your face and you're above 40, go for the 4 vials. It'll be worth it. What we do is we do 2 vials each visit, about 6 weeks apart or so. And it is a gradual onset, so we don't see all the results of that right away. But I promise also, if you came in, you purchased 4 vials, and let's say I would have suggested you only need 3, well, you can hold these credits on your account for up to a year. So we can do that last vial closer to this time next year, and it'll be your annual maintenance. I am totally willing to work with you guys on that. Unless, of course, we have some opportunity at the event tomorrow to meet and talk in person, and I can make a more customized recommendation. But if you're winging it, just know that I will work with you on what you purchase and we'll make it happen. As far as the neck area, I really do recommend purchasing 3 vials. We do 1 vial at a time, about 6 weeks apart. And I think 3 really, I haven't seen anybody really need less than, I think 3 is the sweet spot. And on the glutes, if you're looking to grow that volume, it's hard to do all of that in the gym sometimes, especially when we're trying to cut weight, but we want that volume in the glutes. 8 or 10 vials is really a great place to be. You can't go wrong with 10 vials. If you feel like you have good volume and you're not sure if you are risking overdoing it, 8 vials is fine. But if you have little volume and you've been working everything that it's just you're all small everywhere, you need the 10 vials. If you're looking for Brazilian butt lift results, you're going to need the 10 vials. So it's a lot up front, but it is a really great treatment. Downtime is really just soreness in any of the areas we've treated on the face, not so much on the neck, but on the glutes. You can on the neck see little blebs from the injections for a few days. It's a good time of year going into winter. You can wear turtlenecks and cover all of that up. There is a risk of bruising. I can't promise that we won't bruise anywhere. So do things like take your arnica in advance, avoid blood thinners, and schedule appropriately.
I was going to say on the glutes, not always is it all about volume loss or trying to make it like a BBL. For somebody that's older, maybe you're filling in certain areas where it's changed.
Yeah, yes. So if we have some skin laxity, I guess that does bring it back to the QWO conversation. If we're addressing true cellulite, that is a QWO answer, QWO injectable treatment. I hope you tuned in on Monday for that. But if we're addressing skin laxity, that's going to be more of a Sculptra result, and you might consider 4 to 6 vials for that. It is, if you think of the bum, it's a bigger surface area than the face, so kind of plan accordingly, but you are absolutely correct. Not everything is big volume.
Yeah, I mean, if you want it just to look a little nicer.
Yeah. New collagen looks good everywhere, especially in yoga pants.
Yeah.
Okay, are there actually any questions?
Yes, can you do hands?
Can we do, no, I'm sorry. There are a few spots that we can't go with Sculptra. We can't put it under the eyes or around the mouth because of those round muscles. They would constantly move with blinking, talking, and clump everything together. With the hands, the skin is very thin, and because of the movement of the hands, we don't do it. We're able to do it with the neck because we don't have as much of that movement that we have. So it's hard to stay in the right, you wouldn't be able to stay in the right level of skin.
We could do filler.
But we can do filler here, so you're not at a total loss. Filler is a great treatment for the hands. It lasts over a year. It's a beautiful treatment to help restore volume loss.
Yeah.
How about décolleté and neck?
Yes. So décolleté, we can kind of do one of 2 different things if we're working on deeper lines and volumes versus just surface like crepiness, but both areas can be treated. I would do that same 3 vials. The neck and décolleté I really kind of do in one visit anyways. This might be your target, but I'm going to bring a little bit down to the décolleté anyhow.
Yes.
And what is arnica and why do you take it?
So arnica is a medication that helps with bruising. So we start it prior to treatments because it helps to prevent bruising. It's not going to prevent all bruising, so having it in the system and continuing to take it after treatment helps bruising go away faster. We do sell some here in the office, and the quality of the arnica that we sell as well as the recommended dosage is easier to maintain and follow. So I do recommend you guys purchase that one. It is a better quality one. It has bromelain and other anti-inflammatory treatments that help with swelling as well. Typical over-the-counter arnica-only products just help with bruising, don't help with swelling, and the dosing is typically like 4 tablets 4 times a day. It's kind of a lot. Ours is 2 tablets twice a day, For a 7-day dose, you start it 2 days prior and continue it for 5 days after. And again, it's that extra bromelain and anti-inflammatories and the quality of the active ingredients in it is what makes the medical office supply a little bit better.
Yes, so it's not a prescription medication,
No.
but like a homeopathic,
Yeah.
is that what you would call it?
Yeah.
Medication.
And it is only sold in medical practices, so it's something that's, held to a high standard of quality.
There you go.
Can the treatment be done if I'm nursing?
Well, probably, but the thing is, we don't do studies on pregnant or nursing women. We don't perform medical studies on them, and so we would rather just play it safe and wait.
And the results, are they similar to what you can expect from therapy, or how do they sort of differ?
So therapy really is about creating a microscopic injury in your existing collagen to stimulate the body's response to heal and repair that. Sculptra is about stimulating an inflammatory response to grow new collagen. So where is that different is that therapy, if we're just looking at by 45, we've lost 25% of our collagen, and so the 3/4 of collagen that we still have, we're trying to help maintain and repair, not build new, but repair. That's just about giving that lift and tightening to the skin. No volume correction, because we're not adding new collagen. But lifting, tightening of, being able to see improvement in the jawline. Whereas Sculptra is for, I guess, more volume correction because it's growing new collagen. Right. There are areas that we would treat with therapy to create lift, whereas we would treat with Sculptra to create volume. So different. Fabulous paired together. If we can grow new collagen and improve our existing collagen, that's like a powerhouse treatment.
All right, and then is this someone who's on blood thinners? Can they have Sculptra?
You absolutely can. There's no contraindication why you couldn't. I will caution that you are going to be more likely to bruise. If you are able to safely, per your doctor, permission, able to stop your blood thinners 4 days prior to the treatment, that would be ideal. If you can't, if you're unable to, we would still do the treatment. You just want to allow yourself more bruising time. It's going to take a little longer to heal. You can take arnica if you're on blood thinners, that's safe. And other things that other things that cause bruising, we definitely want to avoid, which would be anti-inflammatories like ibuprofen, Motrin, naproxen, turmeric even, obviously aspirin, if people aren't aware that that's a powerful blood thinner, even a baby aspirin. So if you're unable to stop the aspirin, just plan a little bit more for bruising time.
Okay. I don't see any more questions, so. Let me just get that all pulled up here for everybody. So again, thank you so much, Melanie and Rachel, for talking about Sculptra. I know another very popular topic today and a very popular treatment as well. So I'm excited to see who is going to win this treatment today. So here we go. I'm going to pull up our wheel of potential winners. And the wheel is spinning. And it's going to be, Lacey Walrath. Lacey Walrath. Congratulations. Congratulations. You are the winner of our Sculptra giveaway. So go ahead and send us an email, info@empireeyeandlaser.com, info@empireeyeandlaser.com, and let us know that you are the winner so we can connect and get you the voucher for this fabulous treatment. So again, thank you to everybody who has tuned in over the last 3 days to our amazing live streams with our providers, our doctors. I hope you were able to get a lot of great information out of these things. We are always here to answer any questions you have. Rachel is our wonderful aesthetic consultant. She's always happy to sit down with you and answer any questions that you have about any of our treatments. So that should always be your first step. Make a free consultation with Rachel and talk to her because she has a wealth of knowledge. So don't forget, MAB is going on through the end of the week. You definitely don't want to miss out on this once-a-year opportunity to save big on all of these amazing treatments that we talked about and way more. So give us a call, 661-825-GLOW, to take advantage of these deals today, tomorrow, or Friday. And otherwise, we will see you again at our next live stream, whenever that is. Bye, everyone.